So we're going to be performing a primary survey. So we've just arrived to the scene. We've considered that the scene is safe. We're wearing the appropriate PPE, which is gloves and glasses. If appropriate, we're then going to provide an ethane report, so exact location, type of incident, hazards, access and egress, number of patients, and whether there's any extra resources needed. We're then going to have a look at the general impression of the patient, so whether they're alert, responding to verbal stimuli, painful, or whether they're unresponsive. I'm going to note any signs of cyanosis around their lips, whether they're pale, diaphoretic. We're then going to assess for any obvious life threats, so obviously noting whether there's any major hemorrhage. Also depending on the mechanism of injury, we will then take C-spine precautions. So obviously if they've fallen from a great height, we will then place a C-spine collar on them and do C-spine precautions throughout the assessment. We're going to make sure that we've got 360 access to the patient and note our egress options as well. If the patient is able to, we will then get them to provide us with consent. Once that is all done, we're then going to assess the airway for making sure that the airway is patent and that there's no obstructions such as secretions or blood that may need suctioning. If needed, if the patient is unresponsive and not able to maintain adequate airway, would then obviously pop in the correct adjuncts, airway adjuncts such as like LMA or OPA, NPA, that sort of thing. We're then going to assess the breathing, so checking the rate, rhythm and effort, seeing whether they're using any accessory muscle use or what position they're in, if they're in the tripod position and looking like they're in respiratory distress. We're then going to listen to the 4 lung fields as well, just to note any wheezing, crackles. Yep. And then obviously if they're not breathing adequately, we're then going to provide supplemental oxygen. Then going to check their circulation. So obviously we've identified at the start whether there's any bleeding that needs to be controlled. So we'll do that. Also assess their pulse and for rhythm and quality, whether it's thready or tacky, that sort of thing. And while we're doing our assessment, just making sure, checking for their skin temperature, making sure that they're not too cold, and also checking the cap refill, making sure that it's under 2 seconds. We're then going to determine, start to think about our transport decisions, so determining whether the patient is unstable, potentially unstable or stable, and decide then whether to either we play and stay by doing a few interventions, or whether we load and go to the nearest emergency department, and also thinking if we need to call back up. We're then determining the GCS, so checking their eyes, like whether they're open spontaneously, whether they're obeying commands and speaking in full sentences, and then calculate the GCS based on that. We'd also do a pupil assessment, so making sure that their pupils are equal and reactive to light, and just getting their making sure they can squeeze my hands and push down on my hands as well with their feet. Also, maintaining modesty would also make sure we expose the patient, so whether that means cutting some of their clothing off, just so that we're able to have a proper look at their chest and their limbs, especially if it's they've been involved in a motor vehicle accident or anything like that. So because we want to identify identify any head, chest, abdo-pelvis extremity concerns, and we'll go further into detail with the secondary survey for that. We then obviously want to obtain vital signs, making sure they're in the right parameters, and if the patient is conscious or if there's any bystanders that are able to give us an appropriate sample history, so whether the patient's allergic to anything, what medication they're on, what sort of past medical history they have, when they last ate, which can be important if they've got multiple fractures and they need to go into surgery. The hospital need to know when they last ate, and as well what the patient was doing leading up to this particular incident. And then once all that's done, we can then go down the track of the secondary survey, either en route to hospital or on scene while we do some extra interventions.